So we begin our discussion on pathologies of the endocrine system looking at diabetes mellitus. Now there are two different types. You have insulin-dependent type 1 diabetes mellitus, which we're going to talk about first, and you also have non-insulin dependent type 2. So we'll begin talking about type 1 and mention some of the differences that you will see between type 1 and type 2. Type 1 is typically diagnosed at an earlier age, so many times young children are usually found to have this. Occasionally it does get diagnosed in older adults, but usually type 1 diabetes is diagnosed at an early age. It is an autoimmune disorder, and what it does is it affects the insulin producing cells of the pancreas. So basically what ends up happening is the insulin producing cells of the pancreas kind of die off and no longer function. And really the way this gets diagnosed is through blood work to test fasting blood glucose to see where that stands. So basically the individual no longer produces insulin, so their blood sugars go very high. So that becomes a problem for these individuals, because we know that based upon what we talked about, when you ingest a sugar, your body produces insulin so that you reuptake some of the sugar out of the blood. Well, obviously in this instant the individual will not have this. Some of the health problems that result of this, particularly in poorly controlled individuals who have poorly controlled diabetes, you have various neuropathies, which are just different types of pathologies to the nervous system, retinopathy, so some problems with the eyes, cardiovascular disease, hypertension, kidney disorders, chronic skin ulcers, and just poor healing capacity in general, again because of the effect on circulation that occurs with this. Very important for athletes in regards to athletic activity. You really need to make sure that the insulin regimen is adjusted, because obviously that's going to be the primary treatment for this, is getting some type of external source of insulin to control blood glucose levels. So athletes will need to adjust their insulin if related to activity, especially if their blood glucose is already high. So if they have a really high blood glucose, they're going to have to adjust that so they don't experience problems during activity. Very important when you're noting your in your conditions. Note the treatment of hypo and hyperglycemia when you're talking about diabetes mellitus. So there's different symptoms. So sometimes it can be hard to tell clinically when you have a person with diabetes whether their blood sugar levels have gone low or high. But there are some distinguishing signs and symptoms, so take note of that. And also think of how this affects. So when you're looking at the management of this, really pay close attention to how it impacts exercise. What does it mean for an athlete if their blood sugar levels are high, low, or maybe even borderline? How that impacts whether they have to take insulin or possibly even eat food if their blood sugar levels are low. So looking at the other type, so type 2 non-insulin dependent diabetes mellitus. So type 2 is a situation where individuals do actually produce insulin, and actually in many instances will produce large levels of insulin, so they'll produce a lot, but it's a receptor sensitivity issue. So meaning that basically like saying their body doesn't know how to use insulin the right way, so it causes issues with their blood sugar again. So their body will not uptake the sugar because they don't know how to utilize the insulin. And typically what you see with this usually gets diagnosed in older individuals who will typically be overweight to obese. And we have some of the health problems listed here. So a little different as far as what goes on with type 2 diabetes mellitus. So very common to have hyperlipidemia. So basically high blood lipids, arterial sclerosis, peripheral neuropathy, infections, and various changes in bone could happen in people with type 2 diabetes. Something particular to type 2 diabetes is a complication referred to as hyperosmolar hyperglycemic non-ketotic coma. So this will usually happen in individuals who have some other type of infection or illness. So for instance, an older person who maybe has the flu and also is diabetic. And what this does is, what the hallmark of this is is it puts them in an extremely hyperglycemic state, so very high blood sugar levels, which makes the blood hyperosmolar. So the hyperosmolar part is the blood gets so concentrated because there's so much sugar in it. So what it does is it causes the flow of fluids from the tissues into the blood to help dilute it. Okay, so what this does is it creates a state where the individual could become dehydrated. So basically the fluid shifts from the tissues and everything else into the blood, and it could cause a lot of very significant symptoms related to that. So it could put them in a very severe state of dehydration when this happens. So it's a very bad complication that needs pretty immediate attention. So these are just some illustrations kind of showing the difference between the two. So in the picture in the upper left-hand corner, you see that the insulin producing cells, you see the insulin producing cells getting destroyed. That's kind of illustrating what goes on with type 1 diabetes. With type 2, you have kind of a depiction of the gastrointestinal tract along with the pancreas. So if you follow the steps there, you have the stomach ingesting the food, changing the food into glucose. The glucose enters the bloodstream. So, like normal, the pancreas would make insulin. The insulin enters the bloodstream, but the problem is the glucose can't get into the cells because of the fact, again, the insulin receptors in the body have basically been desensitized. So it causes them to not function the right way. So you have a lot of insulin pouring in, you have a lot of blood glucose in the bloodstream, but none of that's getting used. Okay, so that would cause your issues related to that. Diabetes insipidus is a different pathology. It actually does not involve abnormal blood glucose levels. What actually is affected with diabetes insipidus is the pituitary gland, and specifically the secretion of antidiuretic hormone. So in class we talked about antidiuretic hormone. So if you remember, a diuretic is something that causes you to urinate. Antidiuretic hormone is a substance that gets released in your body that causes you to retain fluid. Okay? So in other words, in situations where you're dehydrated, your body will secrete antidiuretic hormone because it doesn't want you to release fluid into the urine. That's when your urine tends to get very concentrated. Okay? So what happens in this situation is, for whatever reason, we have some different proposed causes, individuals who are not secreting antidiuretic hormone will produce large amounts of very dilute urine because of the fact their body is basically getting rid of all of the fluid that it takes in. Okay, so again, antidiuretic hormone. Okay, if it's not secreted appropriately, the body will release large amounts of very dilute urine. Causes for this: one is idiopathic. Some people have this and they don't really know why. Everything's normal around their pituitary gland. You know, blood values are normal, everything else. For some reason, they just don't produce adequate amounts of ADH. Tumors, if you get a tumor that's pressing on the pituitary gland and affecting the function, that could do that. Sometimes infections could do this, or just vascular problems as far as, normal blood flow to the pituitary gland. But those are all different causes of diabetes insipidus. So just so we're clear, so again, diabetes mellitus type 1 and type 2 and diabetes insipidus, they're caused by different things. So make sure that you distinguish between those different pathologies. Acromegaly is overproduction of human growth hormone. So what happens here is the individual produces very large amount of growth hormone. What this does is it causes continual growth of bones and tissues. So individuals that have this, for instance, if you look in the photograph, very large bone structure, and their bodies do tend to grow very large. So people who have acromegaly are very big individuals. Now, what the drawback to that is, because of the excessive growth of the body, it also puts a lot of metabolic stress on it. So individuals who have this, end up having a lot of cardiovascular, kidney, digestive problems just simply for the fact that their organs can't keep up with this very large body. And one of the fears that you have with this is the amount of human growth hormone abuse in athletics. So this is where it gets to be a little bit of a concern, because obviously if you're supplementing with it and you're taking large amounts, there is a chance that you could be putting strain on the organs as well. Hyperthyroidism is an excess of thyroid hormone. So even before going into this, again, make sure one of the things to be aware of with this chapter is understand what these hormones do in the body. Okay, it'll make getting the conditions much easier. So hyperthyroidism, excess thyroid hormone. So the issue here is the excessive thyroid hormone impairs glucose metabolism. Okay, so people who have this, they have trouble maintaining exercise, and the reason for is their metabolism basically goes so high, and many times just even at rest, the core body temperature is very high, so it causes individuals to have a lot of heat intolerance, which, as we know, during exercise, our body temperature just rises even naturally with that. So it gets very difficult for people who have this to remain active in athletics. They can, but it can be very difficult. A common form of hyperthyroidism is something known as Graves' disease. So again, overproduction of thyroid hormone, and you see in the picture here, it's showing one of the common signs of this is someone that is exophthalmos, or the bulging eyes, and it's actually showing what they call a goiter or an enlarged thyroid gland. So we talked about in class where you can palpate the thyroid gland. If it gets very large and overactive, the individual will experience this. So hyperthyroidism, we have oversecretion of thyroid hormone. Hypothyroidism is a decrease in the secretion of thyroid hormone. So what you have here is just the opposite. So before, you basically had a metabolism that was really revved up and high. Now you have just the opposite. So hypothyroidism, well, now those hormones aren't secreted enough. So you get kind of the opposite effect of the body. In both instances, it's difficult for exercise. It's just difficult for different reasons. So hypothyroidism, decreased cardiac output. So in other words, your heart rate, because of the lack of thyroid hormone, is going to be limited. So the issue there is if the heart rate isn't able to keep up with activity, obviously you're not going to get the circulation that you need in your working muscles to do that. Plus, just the normal peripheral dilation in vessels does not occur in individuals that have this. So the issue there is you get decreased oxygen and glucose going to the exercising muscle. So in both instances, you have situations where the body can't maintain exercise. So hyperthyroidism and hypothyroidism, the individual can't maintain exercise, but it's for different reasons. So it's important to kind of distinguish between the two and what the problems are that arise that limit exercise. Parathyroid hormone disorders. So you have hyper and hypoparathyroidism. Okay, so again, first you got to go back and see what is the parathyroid gland, what does it secrete? The parathyroid gland secretes parathyroid hormone. The function of that is to maintain your blood calcium levels. So you have a certain amount of calcium in your blood. If that drops for whatever reason, you need to have calcium released from what you're basically your next biggest storage of calcium, which are your bones. So parathyroid hormone will get released, calcium will get released from the bones, go into the blood, levels normalize. In situations where you have too much parathyroid hormone, so hyperparathyroidism, too much parathyroid hormone is being produced, you will have excessively large amounts of calcium in the blood. And what that will do is it will put a lot of stress on the kidneys. If it's untreated, it can cause the individual to have kidney stones and also possibly cognitive changes because of what that effect will be on the nervous system. If, on the opposite side, you have hypoparathyroidism. Now what ends up happening is your blood calcium levels drop too low. So if blood calcium levels drop, your body doesn't produce the hormone. It causes a deficit in calcium in the blood. So both of these can affect various systems. They can affect the GI, neurological, and urogenital systems just based upon whether there will be too much calcium or too little calcium in the blood. So hyperparathyroidism, too much calcium in the blood because of excessive parathyroid hormone. Hypoparathyroidism, deficiency of blood calcium because you're not getting the hormone released. Addison's disease is an adrenal gland disorder. It causes inadequate secretions of aldosterone and cortisol. So again, go back, review what aldosterone and cortisol do. Then you can see on the picture where the adrenal glands are, and these particular hormones get secreted from the adrenal cortex. So in the adrenal gland, you have two parts. So the adrenal glands sit right above the kidneys. You have the adrenal cortex and the adrenal medulla. And the biggest issue here is individuals who have Addison disease have very difficult time withstanding both physical and emotional stress. So this would be another situation where you would have individuals who have a difficult time sustaining physical activity, and it's because of a lack of secretion of these hormones that do that. Because again, based upon what those hormones do, they help to regulate that process as it relates to both physical and emotional stress. And Cushing syndrome is an overproduction of aldosterone and cortisol. So again, you have a situation where you have underproduction. Now you have a situation where you have overproduction of aldosterone and cortisol. And typically, this is a complication of corticosteroid use. So if someone has to take corticosteroids for a health condition, sometimes this can occur as a result of that. You actually see some of the signs and symptoms of this as discussed in your textbook. So you can see some of it on here. But so this is when you produce too much. So again, all of these conditions, many times there are situations where there's too much of something. Other times there are situations where there's too little, and both of those have complications associated with them. Getting into environmental conditions, so when we look at heat illness exists on a continuum with obviously starting with heat cramps, which is the least severe, going all the way to heat stroke, which is the most severe. So talking about heat cramps involve involuntary muscle spasms that occur. Most likely this is due to dehydration or electrolyte imbalance. Fatigue also contributes to this as well. So basically what happens is over the course of an athletics event, the muscle kind of adaptively shortens and gets fatigued, and then one strong contraction basically causes the muscle to go into cramps. One of the easiest way is to prevent this, as it would be to prevent any type of heat illness, is through the process of gradual acclimatization. So basically allowing the individual's body to kind of get used to activity in the hot weather. So, given about a week to 2 weeks to kind of get adapted and get the sweat rates up to where they have this. And what you see, particularly in acclimatized people, they typically have much more dilute sweat, meaning that the solutes or the salts in it aren't as concentrated versus an unacclimatized individual who has a really high concentrate of salts in their actual sweat. So very important to make sure that this happens. A lot of times unacclimatized athletes will try to replace their fluids with plain water. The problem with that is it'll actually worsen the spasms because of the lowered electrolytes in their body. So, particularly for an unacclimatized person, it could potentially be beneficial for them to take in a drink or beverage with some, supplement it with some electrolytes to make sure to prevent any issues with that. But you can look also in the text as far as some of the treatments are concerned and what return to play decisions should be with this person.